Good evening. Welcome to tonight's presentation. I'm Andrea Sato. I work on adult programs here at Wilton Library, and we're glad to have you here tonight. Looks like a pretty good crowd. Before I introduce our speakers for tonight, I want to let you know about some other great programs coming up because we have to advertise what's next on our list. Next week, on Wednesday evening, we have rock music historian Vinnie Bruno here to talk about the Motown story. And he shares some excerpts of the music, which is really fun. On Thursday, we have another music program next week in which we welcome two musical performers, a flutist and a pianist, celebrating the Great American Songbook. And that's going to be really fun. So I hope you're able to join. Then we have two really interesting author talks coming up on November 28th. Rob Copeland has a book on the Bridgewater Company, which is going to be very interesting. And on December 4th, Melissa Newman, Paul Newman and Joanne Woodward's daughter, has published a book called Head Over Heels, A Love Affair in Pictures and Words, and she will be here doing an author talk. So please plan to come for that. That'll be really interesting. Tonight's program provides information for those who are new to Medicare, as well as updates for those already on Medicare. Katie Wheeler is Choices Coordinator for the Southwestern Connecticut Agency on Aging. Choices is part of a national network that offers free confidential counseling, education, and assistance to Medicare beneficiaries, their caregivers, and the general public. Lauren Hughes, Coordinator of Senior Services for the Wilton Department of Social Services, will follow Katie, and then they will answer some of your questions at the end of the talk. Please welcome Katie Wheeler.
Thank you for the warm welcome. Like she said, my name is Katie Wheeler. I am here from the Southwestern Agency on Aging. I am the Regional Choices Coordinator there. I don't know if any of you folks are familiar with SWCAA. We do run a home care department as well. Okay, so I'm here to give the Medicare 2024 update and a general overview of the Medicare program. Again, I'm here from SWCAA. We cover the southwestern region of Connecticut. So we cover Monroe, Trumbull, Stratford, Bridgeport, Easton, Fairfield, Weston, Westport, Wilton, Norwalk, New Canaan, Darien, Stamford, and Greenwich. So what is Medicare and who is eligible? It's health insurance for people that are 65 and older, under 65 with certain disabilities, and any age with end-stage renal disease. To get Medicare, you must be a U.S. citizen or lawfully present in the U.S. and must reside in the U.S. for 5 continuous years. Your initial enrollment period is a 7-month window from when you turn 65. So you have 3 months before you turn 65, the month of your birthday, and then 3 months after to sign up for Medicare without facing any penalties. The general enrollment period, usually people sign up the 3 months before their birthday, and then the coverage would begin the first day of the month after you sign up. So if you sign up on February 2nd, it would begin March 1st. So for those that are already collecting Social Security, they will be automatically enrolled in Medicare Part A and B. You would be mailed an initial enrollment package 3 months before your eligibility with your Medicare card and all of the information. So if you're not collecting Social Security, you have to initiate enrolling in Medicare Parts A and B. To enroll, you have to contact Social Security. We put the website on there, but I don't think you could sign up. I don't believe you can enroll online. So you can make an appointment with your local Social Security office, or you could just call Social Security, and they usually can set up a phone appointment with you to get you set up. So the only other thing to think about is before enrolling in Medicare is if you're covered under an employer group health plan. When you are covered under employer group health plan and you are an active employee, you or your spouse, you have to be an active employee, not retiree insurance, and you have 20 or more employees, you can defer enrolling in Part B and D without facing a penalty. You have to have proof of the active employer insurance once you do sign up for Part B, so make sure you are able to retain records on it so you don't face the penalty. Once you or your spouse, whoever you get the insurance from, decides to stop working, you will be granted a special enrollment period, regardless of your age and your spouse's age. So the special enrollment period would start right after your coverage ends. You would have 8 months after your coverage ends to get on Part A and B, and then you have 63 days after your coverage ends to decide if you'd like to get a Medicare Advantage Part C plan and to sign up for a Part D prescription plan. But the A and B side of it, you have the 8-month window there after the coverage ends. There are some Medicare and You 2024 books in the back on the table. I know that most people got some in the mail, but if you need another copy, please feel free to grab one. So Medicare, traditional Medicare covers many preventative services. You would have to talk to your healthcare provider, obviously, to see what services are right for you. But under original Medicare, you'll pay nothing for most preventative services if you get the services from a provider or doctor that accepts Medicare. So here's an overview of Medicare as a whole. There is a couple different options you have. You can go with an original Medicare plan, which would cover Part A, which is your hospital insurance, Part B, which would be your medical insurance, Part D you would have to get, which is your prescription coverage, and you can opt and choose to get a Medicare supplemental insurance plan, also known as a Medigap policy. Then on the other side, you can also decide to get a Medicare Advantage plan, also called just Part C, like an HMO or a PPO. It combines Part A, B, and usually, most of the time, Part D. Keep in mind, if you are on a Medicare Advantage plan, you cannot be sold a Medigap plan or a supplemental plan. So you cannot acquire one on top of the Medicare Advantage. So let's go over some of the costs, which have increased slightly, or some stay the same, and just a slight increase. For Part A, if you worked 40 or more credits, it's going to be free. If you worked 30 to 39 credits, it's going to be $278 a month. And if you worked 0 to 30 credits, it would be $505. The deductible per benefit period for Part A is $1,632. So it jumped up slightly from last year. That would be so if you were in the hospital for 3 weeks, that would be one benefit period. If you got out of the hospital and then had to be readmitted a couple weeks later, that would count as a second benefit period. So you would have to pay the deductible over again. For inpatient stays, after you pay that $1,632 deductible, days 1 through 60 is a $0 copay. Days 61 through 90 would be $408 a day. And then days 91 to 150 would be $816 a day. Skilled nursing facilities, so if you need to go to a rehab after or a nursing home, it would be for days 1 through 20 a $0 copay, and then 21 to 100, days 21 to 100 would be $204 a day. Keep in mind, if you are hospitalized and need to go to a skilled nursing facility after, you have to be hospitalized for 72 hours, or Medicare will not cover it. 72 hours exactly, or more. So keep that in mind, because you don't want to be stuck with the bill. So we'll go over the Part B costs. 2023, the Part B premium was $164.90. It did jump up to $174.90. The deductible for Part B is now $240 a year. If your yearly income is higher than $97,000 or $194 for a couple, you are going to be charged an extra fee. There is a a chart on here, and it's in your packets of information, so you can kind of see what would be additional. So the other option besides going with an original Medicare plan would be a Medicare Advantage plan. So it's also known as Part C. Medicare Advantage is a Medicare approved plan from a private company that offers an alternative to original Medicare. Basically, they bundle Part A, B, and most of the time Part D, prescription coverage, all together in one price. They do have some extra benefits, and some plans do have some lower out-of-pocket costs. Some of the additional benefits would be dental coverage, some vision coverage, hearing coverage. Some of them offer gym memberships and an over-the-counter debit card where you can get a certain amount per month for over-the-counter prescriptions. Some offer a food card. There are a couple new plans that offer a Part B premium give back. So the $174.90 you pay, some of them maybe offer $60 back you'll get a month off that premium. Most of them offer a telehealth service through their private insurance company. Most of them, you can travel with them. And a lot lately also include a free personal emergency response system. So kind of like a life alert system as an additional benefit to it. So the types of Medicare Advantage plans sold in Connecticut in this area, we have HMO, a health maintenance organization, PPO, the preferred provider organization, and then we do have several special needs plans. So for 2024, we have 31 different Medicare Advantage plans in our area. So there is quite a few to choose from. Aetna has 7, Anthem has 4, Cigna has 3, Connecticut has 6, United Healthcare has 7, and then WellCare has 4 plans. So there's only 3 Medicare Advantage plans that do not include prescription coverage. I listed the 3 of them here. If you got those, you would also need an additional Part D prescription plan to have any coverage. So it's United Healthcare Medicare Advantage Patriot, Aetna Medicare Eagle Plan, and then the Connecticut Choice Plan 2. So it would require that additional Part D prescription coverage separately, but for the most part, they include it. So there was several changes with the Medicare Advantage plans this year. Aetna now has a Medicare Discover plan, so a PPO. Several Anthem plans changed their name. So if you're on any of them, the name is going to change and the coverage will remain the same. So it would be the Anthem Medicare Advantage PPO, formerly known as Anthem MediBlue Access Select PPO, Anthem Extra Help HMO, Anthem Medicare Advantage HMO, and Anthem Select HMO. So if you were on those plans, the name is going to change, but it'll have the same coverage. Cigna has also eliminated the Cigna Preferred Medicare. They do have a new plan, though, the Cigna True Choice Courage Medicare PPO. So for that, you would have to call Cigna directly to get the information. Connecticut eliminated these 2 plans for 2024. It's the Flex Plan and the Choice Plan 3. So if you were on any of those plans, you would have to get onto a new Advantage plan before the open enrollment window ends. Medicare Advantage Patriot has a new name for 2024, and also the AARP Medicare Advantage from United Healthcare has a new name as well. And then WellCare, they eliminated their Assist Open PPO for 2024. So there are several things to think about when you are deciding between original Medicare and an Advantage plan. Same questions you should ask for the drug plan, but are your doctors or hospitals in network? To get the most accurate physician information, I always recommend just calling your doctor's office and checking. I would say generally, for the most part, most local hospitals will be in network, but it's still something to check. You need to check and see if you need referrals to specialists. A lot of the Advantage plans require a referral. Some of them also require prior authorization for services. It's definitely something to check on. And then how your total plan costs compare to other Medicare coverage options. So Medicare.gov has a wonderful plan finder tool that can give you a yearly rate of what you're going to pay total for the whole year, including your prescriptions, your premium, everything put into one package and one price, so you can get a good comparison. The Part D prescription plans, this year we have 21 standalone Part D plans. Premiums range from 50 cents. I don't know why they did 50 cents, but 50 cents to $155.80. And the drug deductibles vary as well. So we're going anywhere between $0 as a deductible and $545. So with the Part D plans, an important fact to keep in mind, there is something called a coverage gap. This is, and I'll just kind of read the example, but Mrs. Smith pays her fixed monthly premium every month for her Part D plan. She pays the first, so she has a $545 deductible that she pays before the plan kicks in and covers any of her prescriptions. Mrs. Smith pays a copay, and her plan pays its share for each covered drug until she reaches the amount, it's $5,030. Which would include that deductible. Once she reaches that amount, she then falls into a gap. Once you fall into that gap, you will be responsible for 25% for both brand and generic of the prescription. To leave the cap, the drug costs paid by you, Ms. Smith, or yourself, would 70% manufacturer help her to leave the coverage gap. And she would have to spend over $8,000. After you get out of that $5,000 to $8,000 gap, the plan covers 100% of the prescription. You are charged nothing. You pay $0. It's definitely, if you look at a Part D plan, it will tell you what their coverage gap is. It's just something to keep in mind if you're on some, expensive prescriptions or several prescriptions. So there were some Part D changes. There are some no-pay vaccines as long as you're on a Part D plan. So the shingles vaccine, I believe if I'm not wrong, the flu vaccine, COVID vaccine, I believe is covered as well, 100%, no copay. It's any that are recommended by the Advisory Committee on Immunization Practices. So those would be, no matter what Part D plan you're on, they're going to be a $0 copay. Someone with Medicare who takes insulin, and this change was effective January 1st, 2023, but I always like to mention it. For each type of insulin they take, they are no longer allowed to be charged more than $35 for a 1-month supply. If you're on 2, it would be $70, and you would be charged $35 each 1-month supply. But it makes a big difference. And then someone that gets insulin through a traditional pump covered under traditional Medicare's durable medical equipment benefit, those new rules began July 1st. So it would be the $35 for a 1-month supply, even if it's going through the pump. So we do have a few benchmark plans in Connecticut this year. So there's 3 plans that are all at a fixed rate. So again, very similar to the Medicare Advantage. There are some questions that you should ask. Are my drugs covered? Obviously, that would be number 1. Are they covered under a different tier, which would determine the cost of the medication? Do any of my drugs have restrictions? Some of them have a restriction for the amount you can get a month or the amount you can get a year. Something important to look at if it's a daily medication. And then, is my pharmacy of choice in-network? So is it a preferred pharmacy? Most Part D plans have a preferred pharmacy network where you're going to get the best price. Some people, really have a particular pharmacy they like. Maybe they always go to Rite Aid. You might want to pick a plan, a Part D plan, where you can go to Rite Aid and get the best price, and it's a preferred in-network pharmacy. And then, again, that coverage gap, you really want to ask about that and read up on it, because it can be a large gap there before they will kick in and cover 100% of the prescriptions. And 25% of a brand prescription it gets very costly. So then, if you choose to go with original Medicare, so the Part A and B, it does not cover 100% of your care. So you are going to have a 20% coinsurance and other deductibles. You might want to consider buying a supplemental plan. What that does is it's just going to supplement those co-pays, coinsurance, and deductibles. There is a range, and on the chart there's several different options. It's going to kick in and pay for those coinsurance and co-payments. Plans range in premium and coverage. There's kind of an option for everybody on there, depending on what your needs are. They are a standardized plan. So a Plan G is a Plan G regardless of the cost or the company that you purchase it through. So if you look on the sheet, I believe the Part A, or Plan A, the highest is $1,200 and the lowest is somewhere in the 200s. I don't know the number off the top of my head, but actually I'll move forward. Okay, here we go. So if you look at column A, $1,200 Anthem Blue Cross Blue Shield would charge for that plan, but First Health Life and Health Insurance charges $200 a month. It is going to be the same exact coverage. It's a standardized plan. I don't know why there's such a range in the Plan A. Some people have a preference as far as customer service, or if they've always had Anthem or maybe always had Cigna, they prefer to go with that. But keep in mind, it is going to be the same exact coverage. There is no difference between the $1,200 plan and the $300 plan. So I'd like to go over a little, if you look on the back of the chart, the different options you have. So for Plan A and B, it's going to cover the Part A coinsurance and hospital costs up to additional 365 days after the Medicare benefits are used up. The Part B coinsurance or copayment, so that 20% you would be charged when you go to the doctors, they're going to cover that. And it is seamless. The doctor's office just charges them. You don't have to send in a bill. It's a seamless transaction. They're going to cover your first 3 pints of blood. Also, the hospice care coinsurance or copayment, that would be covered under the Plan A, B, and the D as well. And then A and B do not cover the skilled nursing facility coinsurance, the $200 a day. If you bumped up to a D or G, it would cover that as well. And then the Part A deductible per benefit period. If you go with the B, D, or G, it's going to cover that 100%. So it is a decent-sized deductible if you maybe have a few hospital stays a year, because it's going to be a deductible every time you go back into the hospital and you're admitted. The Part B, so there can be some Part B excess charges. If Medicare has decided a rate for a doctor's appointment or a treatment you need, and your doctor's office is charging more, there is an excess charge there that you are responsible for. I don't speak to too many people that get excess charges. I don't want to, but it can happen. So that's another thing to keep in mind. And then foreign travel emergency, they would cover 80% with Plan D, G, M, and N. If you see the Plan K through N, they kind of cover 50% of the coinsurance or copayment, or 75% of the coinsurance or copayment. So they're a little bit more budget conscious, but you still are getting some coverage, because it can get costly with the 20% coinsurance. Again, you have to keep in mind how many doctor's appointments you have. If you see a lot of physicians, if you're only getting one yearly checkup, maybe not worth it to get a Medigap. If you see a couple doctors and maybe get some testing done, or, it's usually wise to get a Medigap just as an extra security. That Medigap has a continuous enrollment, so you can decide on original Medicare and then 6 months later just say, oh, I think I need a Medigap. I don't know, I'm nervous. You can add it in at any point in time. There's no enrollment period. There's no penalty if you wait till after 65. So it's something you can think about, and in the future add in if you decide not to originally. You can wait till you're 80 and add it in. You could add it in at any time. And you also can change plans at any time, as long as it's within the Medigap plan. If you want to go from an A to an M, or, vice versa. So there are, yeah. Yes. Why? It would depend on why they didn't sign up for the B. Active employer insurance? Active employer, okay, group health insurance, okay. Yes, you can, yeah. As long as you were originally eligible for Medicare prior to 2020. If you weren't, you cannot sign up for the CRF, no matter what. But as long as you had the group health employer insurance and you were eligible before 2020, they'll let you sign up for it. So there are a couple ways the state has tried to make Medicare more affordable. There's something called the Medicare Savings Program. It's available to all Connecticut residents who have limited income. So that would cover your Part B premium. Depending on your level of income, it may cover your Part A and B deductibles, coinsurance, copayment. For a single person, the limit is $29.89 a month. And for a couple, it would be $4,043. There is no asset limit at all on that, so you can have as many as you want. You just have to fall under that income category. If you are qualified for the Medicare Savings Program, you would also qualify for LIS, Low Income Subsidy Program, which just reduces the cost of your Part D prescriptions. And it also pays the Part D deductible. So right now, we are in the annual enrollment period, or open enrollment period, a lot of people call it. October 1st, you should have gotten, you should start comparing your current coverage, reviewing some mailings. Most people got their Medicare and U book around October 1st or the beginning of October, just to try to, get the wheels turning and thinking. Then the open enrollment period lasts from October 15th to December 7th. This is where you can change your Medicare, health, or drug coverage for, it says 2023, but for 2024. So during this period, you can join, switch, or leave a Medicare Part D plan or Medicare Advantage. So you have the option to leave a Medicare Advantage, say you were in it for the last year and it just was not what you need. You have the option to leave it and go back to classic Medicare and add in a Part D plan. And again, that Medigap plan you could add in at any point in time, as long as you're not on a Medicare Advantage. Those changes do not become effective till January 1st. So, but after December 7th, you cannot make any changes to that. So yeah, if you're already enrolled in Medicare Advantage plan, you could switch back and forth. You could drop the Medicare Advantage. You do only have one change. So you have to choose wisely. Okay, so the general enrollment period, which would be just the Medicare Advantage enrollment period, you cannot change your Part D plan, would be January 1st through March 31st. It would be effective the first day of the next month. So say you changed your plan January 10th, it would be effective February 1st. So in this period, you cannot change your Part D plan unless you are eliminating a Medicare Advantage plan and going back to original Medicare. So there are a few special enrollment periods. If you are active on Medicare Savings Plan or Medicaid, you do have an option to change once during 3 periods: January to March, April to June, or July to September. The changes become effective the first day of the following month, and you cannot use the special enrollment period, October to December, but you would be able to change because of the open enrollment period. So there are a few other circumstances where you would get a special enrollment period. If you move in and out of a planned service area, so there are specific plans that may only cover Fairfield County, New Haven. There's a few plans that only cover New Haven County. If you moved out of New Haven County and your plan is not covered anymore, you can certainly go ahead and change plans. If you enter, live at, or leave an institution, so any institution change. If you have a life-changing event, a major life-changing event, you can possibly or probably get a special enrollment period. If you're newly granted the Medicare Savings Plan or you lose it, you also have an option to make changes. And if you lose your creditable coverage, so that would be that group employer insurance, active employer insurance. When you lose that, you get a special enrollment period. Let's see. So I'm a choices counselor. So the department I work in is the choices department. If you have any questions ever with Medicare, any other senior community questions, we get so many different questions. Healthcare, home care questions, any type of resource, you can call us. It's 1-800-994-9422. When you call that number, it is gonna go right to voicemail. You will never nobody will ever answer the phone live, just so everybody knows. Leave a detailed message. We'll call you back within 3 business days, but you will never get anybody. Nobody will ever pick up. So if you hang up and try again, you're not gonna get anybody. It gets automatically directed to the correct Choices Regional Office, and then we can answer your questions from there. So not just Medicare questions, but soup to nuts, anything you could think of, we can try to direct you to the correct place. Or get you the correct resource to, solve your problem. We get a lot of home care calls because SWCAA also runs the CHCP Connecticut Home Care Program for the elder. So a lot of people come through our line and we triage them and make sure they're eligible. But if you ever had any type of senior questions, just give us a call. Again, we will not answer though. Thank you. Sorry, I didn't know if you wanted to go for it. Yes.
Just a minute.
Yes.
I'm coming around with the mic. This, just so everyone knows, we're recording this session, so please don't ask any personal questions. General questions only.
About the supplement
Yes.
and Advantage, you can only switch one time ever, is that correct? Is that what you said?
No, just during that enrollment period. You only have one change during the enrollment period. No, yeah. No, every year you have a chance to change
I just wanted to
and
clarify.
see what would work best for you.
Okay, and I think I read somewhere that if you have certain conditions that you may not be eligible for?
For the supplemental, there are some pre-existing condition. You'd have to look at the chart. So some of the companies do have a pre-existing condition clause. I would direct you right to that company. So if
Okay.
it's Cigna, just call them, find out what qualifies as a pre-existing condition for them. It's usually somewhere between 2 months and 6 month window before it's going to cover you.
I have a question.
Yes, absolutely.
This is related to why my insurance broker recommended one company over
Okay.
another.
Yep.
When they all do the same. So he recommended the most expensive one to me. Is there a benefit for him?
This is supplemental with the supplemental plan? The Medigap on the rate chart?
Med supplement. What am I? Oh, I don't know.
Yeah, you're talking about the,
Okay.
I think you're talking about the supplemental plans that are standardized. I mean, I'm sure there's an advantage to him selling you for a specific company, I'm sure. I don't know the exacts, but maybe he feels they have better customer service. They really are standardized. They're going to offer the same thing. Maybe their 1-800 number picks up quicker than the other. I don't know specifically. It is the same exact thing. Yes. Yes, because there's a really wide range of pricing there. Yes.
Question about the Plan D prescription insurance. The chart lists 21 different versions available in Connecticut.
Yes.
Is there a website to look at?
Yeah. So Medicare.gov has a wonderful plan finder. That is the tool I use every day. If you call me, I'm going to use that tool. So if you go just Medicare.gov, you're going to click on Find Plans. And then it will bring you through. You're going to put in your zip code, all of your medications you're going to list there. And then at the end, it's going to generate the most budget-conscious list of Part D plans and give you the annual cost on top of the premium cost and break down each individual medication and what you would pay on that plan. It is a great, great tool. Just make sure you enter all of your medication, the accurate dosage, how often you take it. It has to be exact or it's not going to be accurate. But that is the best way to find out. Medicare.gov. And if you were having an issue with it or couldn't get it going, just call the choices line and we could just do it for you. We do that all day. That's one of our, biggest things.
If you have,
Oh, yeah.
if you have, both spouses have insurance and one retires and one is 65, do you still have to then apply for Medicare or can you still wait?
So
you can,
as long as you're on one of you or your spouse are on an active employer's insurance group health plan, and they have to have 20 or more employees, so it can't be a very small company. You can go ahead and push off the Part B. You would get on Medicare Part A because it's going to be free, so why not get it? But without suffering a penalty, because there are penalties if you don't have creditable coverage, but as long as it's you or your spouse has the creditable coverage and you're covered, you can push that off as long as you have it.
And if you do Medicare Part A and you both have insurance, which then becomes your primary?
So it would be the group health plan would be the primary.
Okay. Okay, thank you.
You're welcome.
Hi, if you go back to slide number 13,
13.
preventative services.
Oh, yes. Let me get back there, sorry. Yes, okay.
My understanding is the original Medicare doesn't cover the yearly visit to the doctor for preventative services.
So we'll cover a yearly wellness exam. That would be covered 100%. You would not be charged the 20% coinsurance.
Right, but it's not preventative. It has to be, is a well, but the preventative if they code it preventative, is not covered. It has to be wellness. Is a totally different.
It does have to be a wellness exam. You're right. Yes. Yep. Or you're going to pay that 20% co-insurance.
Okay. It's a big difference, actually.
Yeah, and it's a big billing difference. Would be the biggest difference. Yes.
Yeah. So under preventative, if you have a blood test for preventative reasons, that also is not covered under Medicare?
No, that's not. Yeah, that wouldn't be covered 100%.
Okay.
So that would be the 20%. You know, the co-insurance co-payment.
How about the breast cancer screening?
I'm not sure.
Okay.
I would have to check on that. Ellen, do you know? Oh, breast cancer screening. Do you know if that's covered under preventative services? I don't think so. But I can find out for you and give you a call after we wrap up. I can get your number and I can give you a call and let you know. Yeah, in the Medicare new book, it probably states it.
Just a minute. Just got the hand up.
Yes.
Just a minute. Everybody needs to. He's got the same question.
Thank you. My understanding from reading the Medicare new booklet was
Yeah.
that I don't have to register in any way. I did not have to when I turned 65 because one of us always had insurance. I did
Yep.
not register for Part A or anything.
Yeah.
You always mention Part B, but it's true across the board. You didn't have
It's true.
to.
It's true across the board.
Okay.
A lot of people sign up for Part A just because why not? You know, it's free and then you have extra coverage. But yeah, it's across the board. I'm sorry.
Okay.
It is across the board. But I mean, most of the time I recommend signing up for Part A. It's free. Why not?
Okay. Thank you.
You're welcome. Yes. An amazing resource.
Preventive services and a mammogram once a year.
Okay. It is under the preventive services. Okay. You're welcome. Yet the Medicare new book, if you don't have one, please grab one. It lists everything, it breaks down everything, every test, which you're going to pay on traditional Medicare, every exam, blood work. It is like step by step, tells you exactly what you would have to cover.
I have the
Yes?
hand
Oh,
up. My question goes back to, you know, when you have the group health insurance.
Yes.
And if your company is smaller than 20, you do have to sign up for Medicare. My
Yes.
husband's company, it is smaller than 20, but
Okay.
they're part of a PEO organization, the I think it's Professional Employment Organization.
Okay.
And I know when we signed up, if you were part of a PEO, then that meant you had more than 20 employees because
Okay.
your coverage comes underneath that organization.
Oh,
I'm just
yes,
looking
okay.
to see if that's still true. I'm not quite finding the information.
I believe so.
Okay.
I'm sorry. I want to double check. I hate to say yes and then it's a no.
Okay.
But I believe so. As long as it's covered under that larger company you're saying
Yeah.
is the one that's giving you the group health coverage, I'm going to say yes.
Okay.
I can get your info after, though, and just 100% verify.
Yeah, I'm trying to look through the book, but I'm not seeing it right off.
Yeah, and I could look through the book after we're done. But my inclination would be yes, that would cover, yeah.
Early in the speech, you mentioned credits, and I have no idea what you mean by
Yes.
that.
So working quarters. One working quarter, if you worked for 3 months, it would be 1 credit. So you have to work a certain amount of years in order to get the Medicare Part A for free. If you work less than those quarters, you're gonna pay a monthly fee. Yeah, basically, essentially, yes. Yes.
Okay, here you go, here you go.
Slide 37. Making Medicare affordable.
Yes.
The first part of it, is this assistant is state-provided assistance?
So, the state is the one that's kicking in and covering the Part B premium. It's not stated, it's not Medicaid, but it is a state-run program, yes.
So the amount of, let us say, the $4,000, the $43 per month.
Yes.
So
That's the income limit for a couple. So
That includes Social Security
yes,
benefits?
yep, that would include Social Security, any pension you receive, if you get any other type of a monthly payout from a retirement plan, that would have to include that. And so you'd have to be under that 4,043 threshold.
Thank you.
You're welcome. Yes. Oh, sorry.
Thank you. Can we go back to the credits question for a second?
Yes.
So if spouses,
Yes.
where one of them, say, has well over 40, but the other one has less, do they both benefit from the one who has more than 40, or do they pay separately?
No, they would pay separately. It would be they would be,
So it's individually
Yeah, it's
evaluated. So if
individually,
you
yeah.
have over 40, you
Yeah.
get Part A zero
Yeah.
for zero, and if you have, say, 10,
Yeah.
you're, okay,
yeah. Unfortunately, yes.
thank you.
You're welcome. Any other questions?
I just wanted to make a comment with what you said about being separate. Like,
Yes.
Like my parents, they had different plan, Part D.
Yep.
My parents had different Part D, so you and your spouse don't have to be on the same plan.
Absolutely not. No.
I just wanted to make that.
Absolutely not.
Yeah.
A lot of spouses are not on the same plan at all.
Right.
One may have just one extra medication that totally changes it. If you did ever go on the plan finder on the Medicare.gov website, make sure you do it for yourself and then do it for your spouse as well, because you could be on two totally separate plans. Was there one other question? So it's a credit is a quarter, so it would be 3 months. Same as Social Security, yeah, the same. I may not state it in the slide, I'm sorry, but yes, a working credit would be 1 quarter of a year.
I have a question.
Yes. How can I help you?
No, I keep reading how Medicare Advantage plans are more popular these days than traditional Medicare, or at least popular, meaning more people are signing
Yeah.
up for them. I mean, what are you seeing as the trend yourself?
There is a wide range of trends. I want to say a lot of people go, not a lot, but I see a good amount of people going with traditional Medicare, getting a Part A, B, D, and then a lot of the times adding on the Medigap. There are some people that really benefit from the Medicare Advantage programs, though, that like the additional benefits, the dental, the vision, the gym membership, or whatever. Some of them offer transportation services to doctor's appointments, or meals when you get out of the hospital. There are some plans that offer 14 meals after an inpatient stay. There are some people that like those additional benefits. On the Plan Finder, there is also an option to get the information regarding an Advantage plan. So you can plug in all your information and it'll give you the most cost-effective plan. Yes.
When we were looking at plans, whether it was a Medigap plan or
Yep.
Advantage plan, the difference was that many of the Advantage plans, I'm not sure if that's true today, but we were told a couple of years ago that, for example, it would limit, for example, if we chose a Medicare Advantage plan, it would not allow us to go to Sloan Kettering for cancer treatment. It would not allow us to go to hospital for HSS.
You have to check
Yes.
every company
exactly.
and plan is different.
And that's the part that I think is really important to find out what you
very, very important.
what you cannot get access
Yeah,
to.
that's why I put it in that slide. That's a very important question. I want to say most of our, Yale, Hartford Healthcare are covered, but there are other specific hospitals that you cannot get coverage at or care at. So if you see an Advantage plan that you are interested in getting, call them directly and make sure that all the hospitals are in network. And again, the providers you want to check as well, but I always recommend just calling the provider themselves. I think they have the most accurate and up-to-date information. Any other questions? Yes. Oh, wait, one more. Yes. No, well, It incorporates, yeah, I mean, you are, but you're still having to pay the B cost most of the time. But yeah, you're dropping the A, B, and D, and then it's going to incorporate it into a C. Yes. Yes. Oh, sorry. Just coming with the mic.
Just a general assessment.
Yes.
Are the Advantage plans more restrictive than a more comprehensive, A, B, D, supplemental?
I'm going to say generically yes. Depends on
That's
each
all
company.
I'm
Yeah, I'm
asking.
going to give you a very general
high level.
sense. Yes, most providers, and not most, but they would accept traditional Medicare, and some don't accept those Advantage plans. So it depends. It depends, but I'm going to give you a general yes. So he was asking if typically the getting a Medicare Advantage plan is going to be more restrictive as far as what providers you can go to or hospital networks than having traditional Medicare. And I said generally yes. I think they're more restrictive. But it depends on each plan, so I don't want to, but I would say generally yes. Did you have a question?
I do have a question as
Yeah.
far as like skilled nursing.
Yes.
Are they going to take a Medicare over an Advantage? I have someone who works at an administrator.
Yeah.
He said, we will take a Medicare over an Advantage.
Any day. Yeah, I am going to say generally yes. Again, it depends on each plan. I'm going to give it that a general yes. But again, it really, each plan it could be different, yeah.
He said it's so much easier because
I think for their billing, it's easier. Yeah, I think billing-wise.
it'll go to another country.
Yeah.
And they'll say,
Yep, oh yeah. I think billing, it's much simpler, so they would prefer it. But if you guys ever have a question, call the 1-800 number, please. There is a form also on the back table. If you had a very specific personal question, you could fill it out, and I'll give you a call sometime this week. But please call the 1-800 number. My direct line's at the end of the slide as well. You can just reach out to me. Thank you for having me.
I'm very short, so this is not very good for me. Can you hear me if I stand over here? Because I feel like I can't. Oh, there you go. Okay, am I good? Okay. Hi, everyone. I'm going to take just 2 minutes of your time. My name is Lauren Hughes. I work for the Department of Social Services in the town of Wilton. My card is on the back table. This is a massive amount of information and can be really confusing. I'm in the office Mondays, Tuesdays, and Thursdays. I'm happy to take your calls. A person will answer the phone, not a recording. Not necessarily me, but a person. And I'm happy to make an appointment and sit down with you. Our services are free of charge to any Wilton residents. And my friend Ellen back there, who will wave her hand, is a Choices counselor, and she's amazing and extremely knowledgeable. And if you go on that plan finder, which can be very confusing, and would rather sit down with Ellen for an hour and have her go through it with you, or I can do that myself, just call the office. The number's on the card, and we'll make an appointment. You can come in, and we'll help you with all of this, because it's really very confusing. Yes. Not, call social services and see if they do, okay? Weston. Yeah. Okay. All right. Thank you all for coming. Pick up my card. It's at the back table, and call if you have questions.